Hello, Sandra, and welcome, and thank you for agreeing to being part of the first International Virtual Day of OCEAN in March. And would you like to tell something about you? Who are you? Where are you working? Where are you teaching?
Well, thank you, Sandra. It's a pleasure to be here and to participate in the International Virtual Day for OCEAN students. I am Sandra Lois. I am an osteopath. I'm a teacher at FBEO in Madrid. And even though I'm a general osteopath, as we all are, I'm specialized in women's health and all the urogynecological disorders. And that's an area I like to work at.
Yes. And that is also the subject area that you're going to talk about in the virtual.
Yes.
Right?
Yes, I would like to introduce a little bit my lecture and why I will talk about it. And the reason is that we often have some tendency to watch the urogynecological disorders as a different department. As if our patients were my patient, but if this patient has some pelvic issues regarding its visceral aspect, this patient should go to someone else. But I think that we have to turn this thing around. I mean, it's true that sometimes there are certain disorders that need someone who is very specialized in that specific aspect. But we have to be able to know, identify, and treat most of our patients with this kind of disorders because they are very usually related to musculoskeletal symptoms, but also vascular symptoms, neuroendocrine symptoms, neurological symptoms. So as osteopaths, we have to see our patients globally. And we have to stop seeing gynecology and urology as a different department and integrate it into our whole patients.
Right, not to see it separately. You have some expert in the field, right? You have.
Yes, well, I'm an osteopath, but before being an osteopath, I was graduated as a physiotherapist, and in both professions, I am specialized in urogynecological disorders. I have a master's degree in pelvic perineology, it's called in Spanish. And I also teach at the school within the visceral teaching area, but also obstetrics and gynecology. And I've been working in this domain for more than 10 years already.
Nice. Why do you, what would you say, why should the students follow your lecture or your part of the virtual day? Is there something special?
Yes, I think that it could be interesting for them. Most of all, if they have difficulty to integrate the gynecological or urogynecological disorders within their spectrum of competencies. If they find it difficult to identify or to relate to other systems or other symptoms, I think this lecture can help them to get a little bit into it, a little bit deeper.
Very nice. Well, thank you so much, and we are very much looking forward to your.
Thank you, Sandra.
Day.
Bye.
Bye.